So Mount Method, as you might know, is a real simple self-treatment method. So this is different than fluid chi movement in terms of that being an exercise. And this is actually a self-treatment technique. And this is a self-treatment technique that works with supporting the rehydration of the connective tissue, which helps to work to eliminate chronic pain and also improve performance in sports and also everyday life. You'll know probably that this is a completely unique approach to self-care, something I found really exciting because of it is really innovative and very progressive work. And you can really start to sense changes after just one session. It quiets the stress reflex in the body, restores the fluid movement in the connective tissue. More on that later. And it also complements any movement or exercise program. So it complements fluid qigong, but it might complement, well, it will complement things like doing the gardening or the cleaning or the painting, or if you like a sport or walking or yoga or just getting up and down on the stairs, it's going to support things like that. So within 5 to 10 minutes a day, you can quickly start to find ways to minimize the discomfort that you get in response for doing things like that. So my aim is to make sure that you leave your time with me or at the end of a 6-week block to be able to have ways to support yourself at home. And these ways should hopefully over the weeks be land in your mind so that they become simple, gentle and non-invasive. I want you to find realistic approaches for you. So initially when you start to learn Mount, it can be a little bit too much to think about, but very quickly you should understand and start to understand what it is that we're doing, how to be gentle with yourself, and then you can understand and work with it yourselves at home. And of course, there are layers to this practice. So you can either make things simpler and gentler for your body to cope with. And if you're dealing with a lot of pain, you might need to do that at first. And then with repetition and time, your body finds changes start to happen. And then you can move forwards in a way that you can do a little more. You'll learn it so that you can do it easier and quicker. And you'll be able to progress the layers of changes within your body. So as you probably know, we work with either specialized balls and or soft rollers. And we're going to show you in these blocks when we work with Mount Method, how you can eliminate what we call stuck stress before it accumulates. This stuck stress is what causes your chronic aches and pains and signs of aging. It's going to help reduce that inflammation. It's going to do things to support chronic neck and low back pain, improving your alignment and your performance. So anyone can mount. It can be used by an older adult to reduce the signs of aging or reduce the signs of discomfort. But if you're an athlete, they can also use Mount, and you'll see on the Mount Methods website that a lot of people seem very, very sporty. But believe me, they will be dealing with pain and discomfort and pushing their bodies in perhaps a different way than those of us who live with chronic pain. And what you'll find is with time, it's going to decrease joint pain and it will reduce the time it takes for your body to recover after a strenuous either exercise or just an activity. So is the Mount Method for you? I think the questions to ask yourself is, do you want to create a realistic plan for your health and well-being? Are you constantly living with pain and discomfort? And do you appreciate that actually we need to regularly maintain our bodies to create our well life? These things are really, really important. And actually, it does take a little bit of effort. The effort gets easier as you know the technique. And hopefully by it being 3 to 5 to 10 minutes, that you can find ways to fit it in with your life. Keep a ball by the kettle when you boil a kettle. Keep a ball by the sofa when you're sat watching telly. And once you know it, you can do it whilst you're still watching your program and you don't even have to think about it. Regular maintenance. This is a really interesting one for me. So the dehydration in your connective tissue is going to continue to happen with everything that you do in everyday life. So it's a bit like cleaning your teeth. You clean your teeth both to clean them and reduce the plaque buildup, but you're also cleaning your teeth as a preventative to ensure that you minimize the progression of any decay. So this is very similar with melt. You're taking away things that are causing congestion and stuck stress and that kind of discomfort within the connective tissue, but you're also minimizing the potential for problems in the future. So you want to consider, do you want to maximize your potential and minimize your risk? This can be in your chosen sport, but it might also be just to actually maximize the potential of what you can do in the day. Because for some of us, that might be as simple as getting up out of the chair or going out into the garden for a 5-10 minute walk. And what we want to do is find ways that you can slowly help yourselves. So let's look at positive changes that we can create for you. So this is Sue Hitzman and Amanda. Sue Hitzman created the technique. Amanda is one of my teachers. I'm very lucky to have such great teachers. And I think this is a really interesting statement. You can't be efficiently mobile if you're inefficiently stable. And the problem is that even if you were a sports person, what they do is they create patterns which mean that actually often even they are inefficiently stable. So what we want to do is look at ways to support your bodies so that you both are dealing with stuck stress and finding ways to be efficient in your mobility. And just, we all know how exhausting it can be sometimes just to move. And that is partly to do with the fact of the inefficiency of the way that we're functioning as bodies. So very quickly, before we move on, melt is not a cure for anything. It supports your body's own ability to heal. And it's not exercise. People think, do I melt? Do I yoga? Do I Pilates? They are different things. Melt is therapy. Yoga, Pilates is movement and exercise. So this is literally like coming to see me in my clinic. This is why we call it hands-off body work. And it really is complementary to anything.